Hello, everyone. My name is Agli Anushanita, and I am the Vice President for External Affairs at the International Federation of Medical Student Associations. And I am very excited to welcome you to our panel today on Global Health Workforce of the Future, Deployment of Youth During COVID-19 Pandemic. So today we will be having a panel discussion on global health workforce. We have noted that the world is becoming more and more aware of the issues revolving around the global health workforce and its complex aspects. The existing shortage has been even further emphasized during the pandemic era. And as a health workforce of today and tomorrow, many medical students and students of other healthcare related sciences, as well as early career professionals, have experienced something no other generation did: deployment of youth as temporary research capacity in healthcare facilities and involvement of youth in different COVID-19 initiatives. Various experiences have highlighted the adaptability of youth and our resourcefulness. Therefore, today we're going to explore youth-led actions and initiatives that brought about innovative and impactful solutions, and also reflect on the way forward when it comes to meaningful and responsible youth engagement at the times of the pandemic. So without further ado, I will shortly introduce you to our brilliant speakers of our panel today. So firstly, we have here with us Yasin Sholakov, who is the chair at the Junior Doctors Network. We also have with us Jim Campbell, who is the director of the Health Workforce Department at the World Health Organization. We also are joined by Renzo Ginto, who is the Chief Planetary Doctor and also inaugural director at the Global Health Program. We also have with us Paula Regis, a resident doctor in infectious diseases. And last but not least, we also have Iris Blom, who is IFMSA's liaison officer to the World Health Organization. So without further ado, we're going to start. And firstly, I will hand over the floor to Yasin. Yasin, you can go.
Thank you, Egle, and thanks everyone who's connected. So like I was introduced, the experience that I bring to the table is that of having engaged with junior doctors from dozens of countries around the world at multiple points in time, going back now more than 6 months ago, and this is something that we'll keep on doing until COVID is over, until COVID is part of our daily lives in a stable manner. I'm the current chair of the Junior Doctors Network, which is a group of associate members of the World Medical Association, which represents doctors around the world, and that group focuses on those within the 10 first years of practice. I think that there's many things that made the experience of the pandemic particularly different for younger members of the workforce. Firstly, all youth in the workforce are generally either formally students or trainees, or they're at the beginning of their career in a phase where there is still a lot of learning that's part of what they do, and that has changed a lot with COVID. And then young members of the workforce generally have lesser institutionalized power within the healthcare systems, within the health system infrastructure where they operate, and that can have certain impacts. So on that training perspective, the healthcare needs created by COVID have fundamentally changed the distribution of the balance of how training and service is happening. Most healthcare professions have both of those things incorporated very early from the start of the training, because it's something that you learn by doing. But we've seen in certain countries that students were pulled out of their clinical settings in order to, in a certain way, protect them from the virus. And we've seen the complete opposite in other places where students were, for example, made to graduate early in order to contribute as a full-fledged worker earlier than than it was planned, earlier than the training would have normally concluded. Now, we've seen this for young doctors as well, where clinical services were changed or reorientated in a way that meant that they were deployed in settings where they are not used to working in doing medical acts that they were not necessarily fully trained to do, sometimes with lesser supervision because of the whole strain on the systems everywhere around the world where the burden of COVID has been felt. And all of those changes have not only affected people in the last few months, but they'll likely continue to affect healthcare workers in their early careers and in training for the coming years, and those that will finish those programs in the coming years. So it's important to reflect on that. And also it's important to reflect on what might have been missing from training programs, because very many people feel uneasy in the context of emergency response, few of the actual medical professions receive formal training. I'm from one of those few, being a public health physician, and presumably certain other specialties such as emergency training also have that formally institutionalized, but we now see that every doctor must at least have a basis on that front. Now on the side of institutional power, frontline workers are more often younger in many settings, and we've heard a lot of troubles accessing PPE, and I think that's kind of where I want to bring this. We are fortunate to currently be dealing with a disease that affects younger people less than it does older ones. So in a way, we got lucky, but nevertheless, I think it's important to consider the fact that all workers must be protected when in the line of their duty. This means, in the current example, having adequate PPE, but in other examples, it means respecting the rules of conflict and protecting healthcare institutions where there are healthcare workers that are exposed to conflict and that must provide healthcare to groups that are in opposition to each other. I was told to keep it short, and I'm very much looking forward to engaging with the questions. So I'll conclude with one last thought. I think that it's hard to escape discussing anything that has to do with COVID without touching upon the topic of equity. We're at a crux. We have seen a couple of challenges with global equity with COVID so far, but I think we're at a very important point right now where we will see very soon 2 vaccines coming out, hopefully even more in the coming months. And the whole world will look at the developed nations and how they share that crucial technology for the control of the vaccine. I think it's important to reflect that if we are to see, for instance, very low risk populations being vaccinated in developed countries before frontline healthcare workers in the developing countries, we can state that we have failed to deliver on the promise of equity that countries have made in last May at the WHA, reiterated this fall at the WHA. So we have very clear indicators, and now it's time to see who will deliver on that promise. Thanks.
Thank you so much, Yazin, and we do hope to see that the promise will be delivered fully. Next on, we will go to Jim Campbell. So Jim, I would like to ask you, would you agree that these difficult times have properly shaped a new generation of future healthcare professionals? And what are your thoughts on the topic?
Thank you, Egli. Thank you to IFMSA for the opportunity to join you today, and to the WISH hosts for including a full conversation on the role of youth. We've just finished the World Health Assembly last week, a virtual gathering of all the member states, where the topic of healthcare, the health workers in the response to the COVID-19 pandemic featured very, very heavily. The opening address, keynote address to the Assembly this year was from Her Royal Highness Princess Muna Al Hussein, talking about the challenges around the world that we're seeing. And when we look at the global response and the applause and the appreciation, the recognition that's going forward, we also have to consider the need for action to take this further forward. And if we look just behind the big issue of health and care workers, the majority of them are women, and ever increasing share of the workforce are indeed youth, either as young professionals early in their career, or now, as we've seen in the COVID-19 response, students who have been rapidly absorbed into the workforce to come forward. As part of our role in WHO, we're obviously looking across the broad impact on all health and care workers of all occupations, especially those who are at the forefront of the response. And I say at the forefront deliberately because they're in the role of leadership. They are leading our response to the COVID-19 pandemic. And looking at all the instances, and as Yasin rightly mentioned, the issue of personal protective equipment, and infections is something that we have been concerned about since the start. And the data tells us in the first 3 months of the global pandemic, it was a major challenge as our risk management procedures, our clinical protocols, our availability of PPE were found not to be to a standard to ensure that every healthcare worker in the response was protected. But we're seeing the data change, and it's much more encouraging now. But any infection, any death is no longer acceptable. When we particularly look at the youth issues here, we are strengthened by the work that many of your organizations have participated with from WHO for 3 or 4 years now, through the work of the Global Health Workforce Network and the Youth Hub. And most of the young students, the junior doctors networks, all professions are engaged in working with WHO on a daily basis. And we've got better evidence around some of the issues pertinent to youth from the publication and the launch in May of last year, 2019, around the youth challenges. If we look at it in the context of the pandemic, there are perhaps 3 issues that we can talk to today. One is the role of youth in the workforce, and this is the early career professionals. And so the impact, all the COVID impact, is also relevant to them. The second is the move, the surge response to the pandemic, where we've seen students, nursing students, pharmacy students, medical students, taken into a position to provide additional capacity to the surge response, either in clinical facing roles, in public health roles, in tracing roles, or in general support functions coming forward. And then there's the whole issue about the disruption to health professional education, which is going to come back. You know, once we're out of the pandemic, we're going to see a lost year of health professional education. It has been disrupted all around the world, whether you're a first year, a third year, a fifth year, a huge disruption to the ongoing thing. And some countries have yet to reopen their health professional education programs. They're still disrupted today. And so that's going to have a major impact on the workforce of tomorrow. We're not going to graduate as many, or we're going to graduate people with major gaps in their competency and their knowledge development as a requirement. So there are 3 areas that we're particularly interested in. As part of the workforce, there's a broader issues. In one way, the younger workforce have been able to, younger generations as a whole have not been as affected as old generations, but nonetheless, that doesn't prevent them from the stress, the anxiety, the burnout that all health and care workers are facing. The students that are going into new roles, we've identified nearly, so far, over 70 countries where there have been changes to the regulatory frameworks to accommodate this surge capacity, to give students permission to be working in the thing. And that's a bit of a silent revolution around the world in regulatory practice and impact. And it's wonderful to see the volunteers. We saw in Brazil over 100,000 young health professionals volunteered to be part of the surge response. In one state in India alone, in Gujarat, over 100,000 young health professionals being accommodated into the surge response. I mean, the numbers are considerable. Over 1.3 million medical students in IFMSA, several 100,000 nurses and pharmacists, and the numbers that are contributing are significant. This has made a huge impact to our current surge response. But let's come back again to the education. I start to really worry when I see all disruption to education is, of course, impacting everybody, and the disruption to jobs and livelihoods. But if anything that the COVID pandemic tells us is that any solution, any economic stimulus measure, any commitment to invest in our socioeconomic development, has got to include investments in health and education, and has got to include the opening of more jobs in healthcare to respond to the pandemic, to maintain essential health services, and then to try and drive the ambition of the SDGs towards universal health coverage. So we must create more jobs. And so disruption to education is a major, major concern. It's going to have an impact for a decade. It's not just the impact today for the issues of the pandemic, but it's this long-term negative impact to our future workforce that is really of major concern. So they're just some first initial reflections. I look forward to some questions and answers as well. Thank you very much.
Definitely, thank you for your answer. And I would also like to highlight what you said, that any solution or commitment has to include investments on health and education, and youth are an essential part of health and education as well. Now we will be moving forward, and I would like to ask Renzo Ginto for your reflections now.
Thank you very much. It's great to be with IFMSA, my most favorite organization in the world, of course, because I was once a member of the IFMSA, and I think being an IFMSA doesn't end, even if you're out of med school. I hope my Wi-Fi connection will not sabotage my remarks. It's been very erratic since yesterday, and partly because, as you know, I'm speaking from the Philippines. This past week, we just had another super typhoon. You've seen in the newspapers and on TV and social media, entire regions being flooded, underwater, inundated. And that means there's a lot of need for healthcare, especially among the victims. And there's especially a greater need for more health workers who, by the way, are already being overstressed and overworked because of the pandemic. And so it's important to acknowledge that there are multiple crises happening, not just in the Philippines, but in many parts of the world that exert enormous pressure on our limited, scarce health workers. One, through the everyday health needs of people. Universal health care is still elusive in many different parts of the world, including mine. And then you have the pandemic, COVID-19. Yasin and Jim already eloquently describe, the many challenges that health workers and even health professional students are now facing as a result of COVID-related disruptions. And then, as I've mentioned just briefly when I started, there are other forms of crisis that are happening alongside COVID. For instance, climate change, which, as we know, in this year's WISH, is a very prominent theme. I'm actually part of, the advisory group of the Climate and Health Forum that just published a report under WISH this week. We know that climate change did not stop when COVID-19 appeared at our doorstep. And it's just one of the main problems that we are facing now that will definitely require a lot more, workforce to be able to address climate-sensitive diseases, the injuries and disease and ailments coming from extreme weather events, and many others. So that's one, thing that really, bothers me. These multiple crises that are happening at the same time. When I'm asked this question, what is the future of the global health workforce? So I'm reflecting on the title of this panel. And, I realized even before talking about the future, we should, first understand the current situation. What are the challenges that are being faced now? And that's why I started with that background. The Philippines is no stranger to issues around human resources for health. We've always seen as a model in terms of facilitating the orderly migration of health workers. For instance, we're #1 providers of nurses to the United States, #2 provider of doctors to the United States. The National Health Service of the UK is well functioning because of Filipino nurses and other health professionals who are unfortunately disproportionately affected by COVID. I just I learned that in the UK there's this acronym, the BAME, the BAME population, the minorities, again, including Filipinos that are disproportionately affected. In the US, Filipino nurses are the ones saving the lives of New Yorkers. When in fact, in the Philippines, we are actually undergoing enormous shortage to the point that the president of the Philippines had to announce no health worker will be leaving the country, even if you have already contracts waiting for you overseas. Meanwhile, the US, I think it was a few months ago, we know that, there's a travel ban except for Filipino nurses. So they actually allowed Filipino nurses, even provided them an expedited process in order to get their employment visa. So, these are really interesting times for HRH around the world. And then, I'm also reflecting as, a new professor. So you mentioned a while ago that I'm leading a new global health program in the St. Luke's College of Medicine. And since July, I've been teaching medical students looking at a screen. This is part of the Zoominization of medical education, which Jim already mentioned will definitely have, long-term effects, implications on their competency, their capacity to deal with real patients, real people. Dissections are not happening inside, medical schools. So there are a lot of changes that medical students are facing now, including the mental health challenges of, again, looking at a screen for, 10 hours straight. And so, these are just some problems that are affecting health workers in this day and age of COVID. And I've been thinking a lot about the future, how we can really re-engineer a new global health workforce that will meet people's needs and that will be ready for all these future challenges. I think finally I want to introduce the concept of planetary health. As our friends from IFMSA know, I've been very deeply involved in this exciting new field. And I've been thinking a lot about what I am coining as human resources for planetary health, so HRPH. And HRPH, or the planetary health workforce, goes beyond the health professions. We really need to have other disciplines, professions from other sectors to really be part of improving our own health, while at the same time we advance the planet's health, especially as we confront these new challenges of climate change, ecological crisis, biodiversity loss, et cetera, and et cetera. And so what is the future of human resources for planetary health? What is the future planetary health workforce? What are the new competencies that we need, as health professionals and as planetary health professionals to be able to overcome these challenges, address the uncertainties that these complex phenomena are causing, are generating. And so those are some of my questions. And I'm sure, I don't have time to, think about or to talk about some solutions. I hope this is more of a provocation. How can we reshape the future of, the health professions in a mobile world, as I already mentioned about, migration. In fact, it's so funny because one of my professors of surgery back in med school is now a clinician in Qatar. And so, it's just amazing how, the health workforce of the Philippines in particular is scattered all over, but now bearing the disproportionate brunt brought about by COVID-19. And then back at home, we're facing shortages and maldistribution, and plus the overburden, the additional burden caused by the natural disasters that has affected us for the past 2 weeks. So I'll stop there, and looking forward to an energetic conversation with you. Thanks.
Thank you so much, Renzo, for your equally energetic intervention. It was great to hear, and thank you also for bringing to light that, in fact, COVID-19 is definitely not the only health emergency we're facing at the moment. And thank you also for sharing the experience of Philippines. And now we will go over to Paula. So Paula, already in this conversation, there came up some mentions on the workforce in the Brazil. So what would be some of your insights as a resident doctor at the times of pandemic?
Okay, thank you so much. First, I want to thank IFMSA for the invitation to be speaking here. As many of you, I'm also a former member. So it's quite with a sense of gratitude that I come back here to talk with all of you, because it was mainly through IFMSA and the opportunities that IFMSA has given me that it has shaped a lot of the professional I am right now, with this feeling and this vision globally of health and how much responsible we are for carrying a better world, a healthier world. So every single time that I get actually invited to these situations, I stop and try to understand why am I invited and how can we truly share what's being done here and what I've been doing, how can this change maybe and give impressions to other people on what they can do and how can they really have a spot on this work on global health. Coming from a low mid-income country, it's hard to have this global involvement because sometimes we don't have that many opportunities. So again, raising the importance of this combination of health and education, it's so hard. And mainly this past weekend, we just had local elections here in Brazil, and it was really important to see how much youth and the vote from youth was important for electing new people, and mainly how much health was in the agenda topics. So if some people continue to refuse the importance of political determinants of health, now it's like shown to all of our faces how they are determinant for what we're going to do for the health of our population. And thinking on this whole thing of COVID, I stopped to try to think on a timeline, but I think it's so hard to understand what is present, what is the current situation, what was the past, and what we do want for the future, that it's quite hard to have something concise in our minds. We wake up every single day and try to keep ourselves as much updated as possible. But when we do read an article or research, we are actually basing ourselves on data that was collected in the past, a close past, but it's still past. We try to understand what's going on right now to predict what is coming ahead. So of course, it's quite frustrating, but also it triggers on us this sense that we need to keep ourselves updated and that we as youth, we should enjoy this opportunity and maybe our multitasking characteristics to have the best possibilities and to have the best work on what we can do. At this point, I come to us as young health professionals, and usually we are afraid of saying that we don't know. We are afraid, especially in the environment of being a resident doctor or a student where you are in your internship, we are afraid of admitting that we don't know something. But actually, I think that COVID has taught us that no one knew that much about it. So it makes us feel more confident and comfortable on admitting that we don't know. And when you assume that you don't know, it's actually the first step to recognize that we need to know and that we need to study, we need investment, and we need to foster the sense of the combination of education to limit the inequality that we have in access, that we have in health. And saying this from a personal side, what I can say is like during this moment, maybe I have addressed my insecurities and to find a spot for me and what to do at this. And as many of us, I do conciliate the work and clinical field every single day. I do work with COVID patients, but at the same time, I do also research work. So I think this combination can show me the importance of exactly learning how to do it and not only being a good professional with your patients, but also being able to transform all this knowledge, all this information that we get every single day into a tangible conversation, into something that you can make clear to your patients that may not understand as much as we do all this clinical language that we have. However, also these multitasking activities that we have affect us a lot because our mental health is actually in the focus of this. So all the insecurities that we have are potentialized by not knowing, by this fear that comes of not knowing on how to do something. But then I think that when we try to conciliate this, it's important to find our niche and that specific spot or situation or attitude that we can have that make us doing the best, what make us shine or make us doing the really feeling of doing the right. Confidence and comfort come together on this, and for you to have like a spot save it or your work save it and so. So just to sum up, I'm the youngest national coordinator for the WHO Solidarity Trial, and being at 25, doing something that is done in a global scale with more than 14,000 patients added and randomized into the trial, was really a challenge. And it's a challenge with the sense of extremely gratitude and a rewarding experience, because I'm being able to be exposed to the global work, and the global work in a really global scale through the WHO and through the Solidarity Trial. And sometimes we try to think about the right place and the right moment when I'm supposed to do something, but every single day, actually, there is no right place and no right moment. We are the ones supposed to build the right opportunities for us. And just to sum up again and to have a final conclusion, young professionals, we must be heard, but we also do need to how to do it the best way, how to talk the best, how to access people, and how to be able to teach and to help also the others, not letting our age to limit our responsibilities or to limit our potentials. Thank you.
Thank you so much, Paula, for sharing your valuable insights. For our audience, I would also like to remind that they are also able to ask questions that we will proceed to after our last speaker. So now we're moving on to Iris. So Iris, as liaison officer to World Health Organization, the IFMSA, you represent the voices of more than 1.3 million medical students. What are your thoughts?
Yeah, thank you so much, Egle, for the introduction and also for providing me with the floor right now. And thank you to all the panelists so far for their excellent interventions as well. I would like to take all of you back to the beginning of the year. As the pandemic was just breaking out across the world, as a fifth-year medical student myself in the Netherlands, I was sent home. Our rotations were all halted immediately. And when I think of that time, it brings up a feeling of uncertainty that I think was felt all around the world. At that moment, I started to talk with my fellow medical students in other countries that actually have become my friends over the years because of IFMSA. And to my surprise, I learned that the role of medical students differed greatly across these countries. For example, one of my close friends in the UK was fast-tracked to work as a medical doctor, and I was sent home. And this sparked an interest in us. This is when we got together and we started to research what the role of medical students should be during health emergencies. And we actually looked at health emergencies in the past. What have young people, medical students, and other young people done in the past? Just some examples: during the 9/11 terrorist attacks in New York, in the US, medical students provided meals to rescue workers, and they also provided psychological supportive care to families of victims. In 1918, so a very long time ago, during the outbreak of the Spanish flu, medical students acted as nurses and interns because the usual medical workforce was actually away in many countries because of the war. And in the 90s, a lot of medical students educated each other through peer education on HIV and AIDS to remove the stigma in the health workforce. So these are just some examples, and we set out to see what the role of medical students was during this pandemic. And what we found was that there was also great variety. So going from raising awareness to providing medical care, providing logistical assistance, assisting health workers at home. And the IFMSA created an overview of the 75 different projects that were set up by our national member organizations in their communities. And these projects, again, illustrate the creative and I think also the wide variety of contributions that young people have made. And one example, actually going to the Philippines, medical students there translated all health information into the different languages and dialects spoken in the country so that everyone could understand this health information. In Zimbabwe, medical students created videos of hand washing, hygiene in English, but also the local languages. They had WhatsApp presentations on COVID-19 prevention. They created infographics that were released every 2 weeks. In Qatar, where WISH is being held, medical students organized webinars focusing on the direct and indirect impact of COVID-19 on mental health, with the additional aim to reduce stigma as well. In Portugal, medical students organized a podcast focusing on informing people living with HIV or AIDS on the COVID-19 risks and how to take precautions. Medical students in Colombia and Canada, they actually got together and they organized a webinar focusing on human rights, gender inequities, and also domestic violence within the COVID-19 context with the aim to empower participants that were mainly medical students and other students to act as advocates for human rights. These are just some of the examples of the efforts of young people. If you want to learn more about this, you can actually check out the IFMSA website, where we have an interactive map of what young people have done all over the world. Now, why am I providing all these examples? This is because even though youth constitute 1.8 billion people across the globe and represent therefore one of its biggest demographics, in addition to the impressive contributions that I've just mentioned, there needs to be a more meaningful engagement of youth with decision making. Youth needs to be part of the design, the implementation, and the evaluation of policies on the global level, but also very much on the local and the national level. Going back to what I mentioned about me being sent home in the Netherlands, we should have been part of the decision of what medical students had as a role in that pandemic. That's just a very specific example, but it goes on all levels in all countries and globally as well. So this is what I see as the ideal for the future global health workforce, and I'm very excited to continue our discussion in this panel and beyond.
Thank you so much, Iris. So with that, we will be moving on to questions. We have received quite a few. So firstly, I would like to start with some insights on the COVID vaccine. So already during this panel, Yasin mentioned that there has to be equity considered in the distribution of the vaccines. But in general, I would like to ask our panelists, what is going to be the impact of COVID vaccine on the health workers, and what are your thoughts in general, as this has been quite buzzed about topic lately, and especially in the past week? And I would like to start with Jim.
Thanks. I mean, a highly topical issue. As we see the encouraging news around the world, early results from those vaccine candidates in phase 3 trials. At WHO, the Strategic Advisor Group of Experts on Immunization has issued guidance on the allocation of the vaccine and how national countries should be looking at these issues. Health and care workers are part of that first wave of potential vaccine to ensure that we have the healthcare service and the care service to be actually continue managing the pandemic. Obviously, those who are in the forefront of the roles in greater exposure and greater risk, the assessments will be done to give them to further. But I think broader than that, if you start to look at the ambition of 2 billion doses being made available in a 12-month period, despite the different vaccines and their cold chain requirements and the challenge that brings for logistics, if you actually look at the challenge of 2 billion doses, I heard the International Council of Nurses describe this as the equivalent of landing a person on the moon. It is a global undertaking. And who's going to have to deliver that? Health workers. Which health workers are going to be at the forefront of that? Again, it's youth are going to be actively engaged in this. So it's going to come down to early career professionals, to our nurses, to others, to think about how to drive that agenda forward. And where is the 2 billion doses? 3/4 of it in low and middle income countries. And it's those low and middle income countries that have a shortage of healthcare workers. So the burden of vaccine, this additional workload, is going to fall on those healthcare systems where there are fewest healthcare workers who are under stress, already being challenged by the pandemic in essential health services. So it's a real major challenge. We need your support, all the associations, all the youth groups, all the professions. We're going to need your support to make sure that we approach this and really take it further forward.
Thank you so much for your answer. I would also like to direct the same question to Renzo.
Yeah, thank you. And again, I hope my connection will work this time. It's so funny because you mentioned about the shortage of health workers, Jim, in developing countries, including the Philippines, despite being a major exporter of health professionals. the president of the Philippines had an idea, maybe he should deploy the police and the military in vaccinating the population. I don't know what will happen with that plan. But having said that, I think beyond the the recruitment, the numbers of health professionals, including early career professionals, health profession students that we need to engage in this mission of vaccinating an entire population. I think we need to make sure that the protections are there for them. And interestingly, in the Philippines, there's a lot of discussion about interns who are final year medical students being required by some medical schools to actually go to COVID hospitals, and some students are not happy about that because there are no protections being provided, from health insurance to enough PPEs to make sure that they don't contract the virus. And so, I think I support definitely the involvement of young people and early career professionals, but we need to make sure that the safeguards are there, because we don't want our young people, future physicians and nurses and others, to be infected by the virus irresponsibly.
Thank you so much. I will hand it over now to Yasin to add on that.
Thanks, Egle. And thanks, Jim, for setting the stage with the moon landing analogy. I think it's very appropriate, and I wish to restate my statement about equity. It's the kind of thing where we all need to work together. I think not only providing the vaccine to all countries around the world is important, but also supporting healthcare systems and the healthcare workers in those healthcare systems in order to be able to deliver the vaccine is crucial. A vaccine is nothing. An immunization program is what you need, and that's a complex thing to accomplish. This being said, I think we can optimistically say that 21st century, we've had our eye on Mars, so I think a moon landing should be should not be beyond our capacity. And I think one important thing to state about the access to the vaccines for healthcare workers, I would presume that most systems would indeed put healthcare workers very high on the priority lists, like SAGE has done, and like all the prioritization lists I've seen. I think, however, there must be the concern that the vaccine does not replace other means of protecting healthcare workers. Vaccinated healthcare workers are not healthcare workers that can go and work without PPE, without personal protective equipment. Vaccinated healthcare workers should not be put at higher risk than their colleagues. Basically, the vaccine should be made rapidly accessible to most people that would be at risk of acquiring the disease. So those are important considerations. Thanks. I'll keep it short.
Thank you. And lastly, handing over to Paula.
Yeah, I will just shortly add something, because it's not only about the work in the field, but mainly the work behind it. So the importance of healthcare workers also to the decisive role that we have against fake news around vaccines, that is determinant. For example, in every single appointment that I have with my patients, they will ask my opinion about vaccines. This is really important that we can now advocate together and show the importance of trustable vaccines, but also to show this trust to our patients and to people that actually don't have access to that much information as well. Thank you.
Thank you. And finally, as our panel is coming to the end, as Jin has outlined at the beginning of the panel, the next year is the year of health and care workers. So the very last question to our panelists would be, what is one concrete intervention that associations and early career professionals and students can do to support this year of health and care workers? And with this, we will start with Iris.
Yeah, thank you so much, Egle. I would say for the one thing that can happen right now is that we see a second wave in many countries going on at the moment. I call on universities and also medical students and other healthcare students at those universities to go into conversation together on how the response can be best coordinated, including the youth.
Thank you so much, Iris. Over to you, Renza.
Mine is short. Stand up, speak up. This is your moment. Take advantage of the COVID moment. So, yeah. And I know IFMSA students always do that. Thanks.
Thank you. And also, we are proud of our IFMSA alumni. Over to you, Yasin.
I think that we can build on our network, so make sure that we work hand in hand with our colleagues from other professions that are also there on the front lines with us, and ensure that all that we do is for the betterment of all health and care workers.
Thank you. Over to Jim.
I think we can learn an awful lot from the Year of the Nurse and the Midwife. Clear, simple message, organize for action.
Thank you. And lastly, over to you, Paula.
I think I would just try to sum up. It's take advantage, as said, and use out the most of our potential. The use that we can do with social media and how many people we can reach through social media. So use the best potential that we have as youth and the energy that we have to mobilize the world.
Thank you so much, Paula. And with this, we will be ending our panel today. And I truly invite our audience to take all these messages beyond this short event today to their lives and to the reality of young people. As IFMSA, we call upon all stakeholders for actions to actively search for meaningful and innovative solutions for youth as healthcare workforce. And we also call to amplify the institutional power of young professionals. Thank you so much for attending our panel. Thank you so much to all the brilliant panelists. And we hope to see you in the rest sessions of the WISH conference. Thank you and have a great day.
Thank you.